Learning outcomes. After studying this module, you shall be able to know about the anxiety disorders in children, learn about their causes, identify about symptoms, and analyze how they are treated. In our everyday lives, we may experience some type of uneasiness or discomfort in certain situations or in certain places, etc. These feelings can range up to mild discomfort to highly unbearable feelings like panic attacks. This feeling of uneasiness can be experienced by all age groups and it may vary in intensity. For example, in adults, it may be common to experience anxiety in situations where they need to meet with a deadline at work. Anxiety can commonly be experienced by children also, such as when they have an exam to write or in situations with high adjustments like divorce of parents or change of school, etc. Sometimes anxiety can be useful and motivating in our everyday lives. For example, when we are worried about writing a test, that worry or anxiety motivates us to work hard and we end up preparing better for our upcoming challenge. But when this anxiety becomes overly strong and takes over the senses of an individual, which forces him to stop using his mental abilities, problem solving skills, doing his daily tasks, avoiding social settings and disturbing the daily functioning of the individual overall, it becomes pathological. Anxiety is like an alarm system to the human body, which is activated when our body experiences danger or an emergency situation. When the person finds himself in such a situation, he feels certain sensations such as sweating, palpitation, increased heartbeat, dizziness, high blood pressure, etc. These sensations are called fight or flight sensations. Anxiety is a complex mix of unpleasant emotions and thought processes that are both directed to the future and much lesser than fear. Anxiety is not only consisting of cognitive or subjective factors, but also consists of physiological and behavioral changes of factors. The three components can be seen clearly in an individual suffering from intense feelings of anxiety. At cognitive or subjective level, the individual experiences negative mood, worry, a sense of inability to predict the future threats and self-preoccupation. At physiological level, it consists of bodily changes from within and outside as well, such as palpitation, high BP, sweating, dizziness, etc. At behavioral level, the anxiety consists of behavioral changes such as the urge to take flight or fight from the situation. Anxiety is an emotion identified by thoughts filled with tension and worry as well as feelings of restlessness and several bodily or physical changes like increased level of blood pressure. People diagnosed with anxiety disorders generally have repeatedly occurring intrusive thoughts or concerns. They try to avoid going to certain places or be present in certain situations out of worry. They may also have physical changes or symptoms in the body such as palpitation, sweating, shaking, trembling, dizziness, etc. Anxiety is considered to be a pathological condition or a disorder comprising of an excessive sense of apprehension with physical symptoms such as sweating, palpitation and feelings of stress. There are several disorders caused due to excessive anxiety experienced by an individual. It can occur in adults as well as children and adolescents. Thus, anxiety is not something that comes or develops with age. There are several environmental as well as internal factors on which the occurrence of these disorders depend upon. Now we come to the types of anxiety disorders in children. Anxiety in children is not easily identifiable because children have a lot of energy which keeps them moving around, they are energetic. To the parents, the high level of activity of sometimes irritability might seem very normal and therefore they might ignore the symptoms that might be leading a child to an anxiety disorder. Thus, it's very important for the parents or the caretaker to identify the type of anxiety that is being experienced by the child. Doing so will help the therapist to treat the child accordingly, and also because the treatment that is chosen depends upon the symptoms or the types of anxiety the child shows. The first type of anxiety disorder that we are going to discuss among children is generalized anxiety disorder, which we also call GAD. Anxiety is an emotion which has an adaptive property. This property helps the individual to plan and prepare for future threats or sometimes even events. But for some people, this anxiety and worry becomes a matter of great concern because it takes a chronic, excessive and unreasonable twist for them. These individuals suffer from what may be diagnosed as the generalized anxiety disorder or free-floating anxiety. Diagnostic guidelines given by ICD-10 for GAD are that the person or patient must show primary symptoms of anxiety most days for at least many weeks at each time and generally for many months. These symptoms should comprise elements of motor tension, which may include headaches due to tension, restlessness, shaking in complete body, lack of relaxation. Other is autonomic overactivity. That may include lightheadedness, sweating, tachycardia or tachypnea, epigastric discomfort, dizziness, dry mouth, etc. And next one is apprehension, which includes tension about future mishappenings, feeling on the edge, lack and inability in concentrating, etc. These are certain ways in which the therapist or the psychologist may diagnose the generalized anxiety disorder in the child. They may use very specific observations and some tests that are completely suitable in assessing the level of anxiety in the child or adolescent. In cases where the child is too anxious or too small to talk, the parents are investigated in order to gain completely reliable information. In such of adolescents, it is better to ask him or her because at that age he or she is more aware of his or her bodily changes than anyone else. Some causes of the generalized anxiety disorders have been mentioned below. Psychosocial perspective believes that this disorder is a result of the unconscious conflicts between the ego and the impulses due to the lack of development of the defense mechanisms in the patient or because they have been broken down. It is believed by Freud that the sexual impulses or the aggressive feelings that are suppressed in the past with punishment or negative reinforcement come out as free-floating anxiety in the present. Another explanation given by psychoanalytic psychologists is the repeated occurrence of unpredictable and uncontrollable events. In cases where this happens, the individual is never ready for the defending behavior and is caught by surprise all the time. This leads to an unsettling and unexpected worry all the time about the unpredictable events that might take place. Cognitive biases for threatening information are another causal factor which psychoanalysts came up with. It is believed and has also been proven with the help of studies and researches that an anxious person will perceive any information as negative and threatening as compared to a person who is not at all anxious. Thus, these individuals who are suffering with anxiety preferentially allocate their attention to the situations that are threatening, worsening, and they never come out of this problem. There are some biological causes as well which may lead to generalized anxiety disorder. Genetic evidence of GAD is mixed. It does seem likely that there is a modest heritability, although smaller than for most other anxiety disorders. Another biological cause may also be the functional deficiency of GABA. Next anxiety disorder very prevalent among children is separation anxiety disorder of childhood. It is commonly seen that preschool children and toddlers show some signs of anxiety at some level. This type of anxiety can be seen at times of mother-child separation or the caretaker and child separation. Separation anxiety disorder should only be confirmed when the fear of separation comprises high degree of anxiety and especially during the early age of childhood. The word separation in this disorder is one that is different from a regular separation such as a divorce of parents, death of parents or caretaker or associated to serious disturbances in the social functioning of the environment in which the child lives. Children with separation anxiety disorder have higher tendency to worry about separation than children who do not suffer from this disorder. Even slightest of the separation can overwhelm the child in such cases, such as going away to attend school, sleeping, when the parent has to leave the child at home, or when he or she has some outside work to do. The child may experience extreme fear related to the death or major illness of a parent due to fear of losing one of them. If the child wants to let the feeling of anxiety go away, then he tries to cling on to the parent the whole time, not to go out and play with other children, and sometimes also making excuses of stomach aches or headaches to stay with the parent. It is commonly seen that the child can stay away from one parent much easily than the other one. This disorder is difficult to diagnose because children who have this type of anxiety may have other types of anxiety disorders other than this one alone. Such children have many bodily complaints like mentioned above, including stomach aches or headaches, which lead to the parents getting more worried about them and subsequently spending more time with the child. It is important that a specialist in this field, such as a psychologist for children, handle such cases by collecting appropriate information about the child and then leading to a conclusion. Some of the symptoms identified by ICD-10 are an imaginary and constantly occurring thought of tension about something wrong or harmful happening to the closest person of the child, an imaginary constantly occurring worry that unexpected and scary event might take place that might separate the child from his loved ones, persistent, repeatedly occurring or a constant fuss about not sleeping unless the loved one or the attachment figure is around the child, constant and inappropriate worry of being left out alone at home or outside at any time of the day, recurrent disturbing dreams about separation, constant occurrence of bodily symptoms such as nausea, stomachache, headache, vomiting, etc. in situations that involve separation from a major attachment figure such as leaving home to go to school, overly and repeatedly occurring stress in anticipation of, during or immediately following the separation from a much loved one. Some causes of separation anxiety disorder are: this type of anxiety often occurs after there has been a very sad and disturbing event in the life of the child. These events may include the loss of loved one, loss of a pet, migration from one place to another, joining of the school, etc. Another cause may be that some children have overprotective parents due to which they develop such a disorder. Also, there is a possibility that they may not be true a cause of the child's anxiety, but just a pass on from the parent itself. The fact that anxiety of the parent can move on to the child shows that this disorder can be inherited. Phobic anxiety disorder of childhood. Phobias in adults can be explained as when an individual who suffers from a strong and persistent fear that is unreasonable and excessive and is enhanced or triggered when the individual is in the presence of a specific stimulus or situation. Phobias may become so intense sometimes that they may resemble panic attacks, but the only difference between the two is that the phobias have a specific stimulus or are triggered in specific situations, whereas on the other hand, panic attacks are experienced without any specific stimulus. In children, phobias may not be the correct term, but phobic anxiety can be used in their case. Children, like adults, can also develop a fear for specific objects or situations and are also identified as phobias. But some fear of specific objects like agoraphobia may only be during the developmental phase and they might subside over the years, thus called phobic anxiety. During childhood, the most common fear is of animals, especially during the preschool years. When the child comes across a situation which he fears, he tends to start crying, becomes clingy, freezes there, or may also throw tantrums. This disorder has a very short lifespan if treated and taken care of in time. But if this disorder is not taken care of and is enhanced due to certain environmental difficulties, then it may develop into a social or specific phobia in the growing years of the child till adulthood. Some commonly seen childhood phobias include the fear of planes, injections or sharp objects, dogs, bugs, spiders, lizards, etc. Symptoms of phobic anxiety disorder in childhood as mentioned by ICD-10 are mentioned below. The beginning of phobias happen during the developmental years of the child. Level of anxiety needs to be at such a level that it is clinically abnormal, and the anxiety does not form part of a more generalized disorder. Next disorder under childhood anxiety disorders we discuss is social anxiety disorder of childhood. Other than specific type of phobic anxiety, the child may also experience social phobic anxiety, which may occur in situations which are overcrowded, and the child might feel distressed on seeing so many new faces, and also situations where the child is required to make a public appearance or public performance. This phenomena is normally seen in the second 6 months of the child's life as he moves out of his or her home environment into the outer world and experiences new and strange situations. Thus, this classification must be applicable for disorders that are diagnosed for children below the age of 6 years. During these years, the child starts going to school and makes new friends, performs on stage, confronts teachers, meets new people in school, etc. For some children, this may be a wonderfully new and amazing experience, but the children who are afraid of such situations may experience social anxiety. Some symptoms of the social anxiety disorders are given by ICD-10 as are stated below. Children suffering from this disorder are seen with a repeatedly occurring fear of completely strange people. A fear is associated with a normal degree of selective attachment to parents or to other familial person. The avoidance or fear of social situations is of a degree that is outside the normal limits of the child's age and is associated with clinically significant problems in social functioning. Social anxiety disorder may be caused due to some of these factors, like genes. Genes play an important role in explaining the biological cause of this disorder. That is, if the child's parents or any relative close or far has similar condition, then there is a possibility of the child acquiring that condition too. Next, it is also believed that certain individuals develop this disorder because they have seen anxious behavior around them all their life and learn from them. There is also a possibility that this disorder is a result of overprotective parenting style. The life experiences of the child may also cause the child to acquire this disorder. For example, if the child has been humiliated at some point of time by his friends or teachers, he may have been bullied, sexually abused by an elder person, family conflicts, divorce or separation of the child's parents, etc. Children who are withdrawn, restrained, shy or timid when confronted with a new situation are thought to be more prone to developing social anxiety disorder. Now we discuss some of the treatment techniques of the childhood anxiety disorders. First one we discuss is relaxation techniques. When an individual is suffering from anxiety, a lot of bodily changes take place, including dry mouth, increased breathing, palpitation, sweating, fastening of heartbeat and sometimes high blood pressure. Whereas in relaxation mode, the individual is in a completely opposite state where he or she breathes slowly, body temperature is cool, heartbeat is normal and stable, body muscles are relaxed, etc. Thus, if anxiety needs to be decreased, it is very important for the person to be relaxed. Thus, the relaxation is an anxiety relieving tactic. Relaxation techniques have been found to be most effective in the betterment of the generalized anxiety disorder. Some commonly used relaxation techniques have been found to be most effective in the betterment of generalized anxiety disorder. Some commonly used relaxation techniques have been mentioned below. First one that we discuss is progressive muscle relaxation. This type of relaxation is specifically for the muscle relaxation, wherein the individual suffering from anxiety disorder systematically tenses and then relaxes each and every part of the body. This exercise should be done in one direction, that is from head to toe or from toe to head. And as your body relaxes muscle by muscle, the mind will follow automatically. The next technique is deep breathing. Breathing in an anxious person becomes intense and faster when he faces a difficult situation or object which causes bodily changes such as dizziness, breathlessness, lightheadedness, dry mouth and much more. Therefore, the aim of this technique is to stabilize the individual's breathing pattern in anxiety-provoking situations. Meditation. Meditation is a type of relaxation technique which has been found to be extremely effective not only for anxiety disorders but also for other disorders. The most effective type of meditation has been proven to be effective is the mindfulness meditation. If the meditation is performed on a regular basis, then it is believed to boost energy levels and activity on the left side of the prefrontal cortex, which is considered to be the area of brain responsible for feelings of serenity and joy. Next treatment modality we have is cognitive behavioral therapy or CBT. Cognitive behavioral therapy or CBT is a type of therapy which has been found to be very helpful in treating anxiety-based disorders. Task of cognitive behavioral therapy is to help us find out the distortions in the way we look at the world around us and ourselves and correct them into healthy ways. In this type of therapy, the child is taught to identify the negative feelings and thoughts and then taught to replace these negative thoughts with positive ones. The child here is also taught how to distinguish between the unreal and real thoughts. The child will receive homework to practice what is learned in therapy. These are some techniques that the child can use immediately and for years to come. The psychologist or therapist and the parents of the child take care whether the child is improving or not in the home as well as in school setting. CBT generally is short term and sessions last about 12 weeks, but the benefits are long term. CBT consists of 4 steps. Number 1, education. The child who comes to the therapist might not even know what he is there for. Thus, the child's parents need to understand very clearly the meaning of anxiety and what type of anxiety it is. Only when they have complete information about their child, they will be able to cooperate with the therapist. Next step is monitoring. It involves the tracking of specific situations in which the child experiences maximum anxiety. How long the anxiety lasts and what are the physiological and behavioral changes that take place at that time. Cognitive control strategies, that's the next step. So with the help of CBT, one learns to think realistically and then change the complete mind process and patterns simultaneously. As the child is made aware of these negative and disturbing thoughts and made to confront them, they will slowly subside and the child will get used to such situations, and also the feeling of anxiety will subside over time. Behavioral strategies. Some effective behavioral techniques are problem solving skills and time management. Next treatment modality we have is pharmacological treatment or medication. There are 3 types of medication prescribed for generalized anxiety disorder specifically. There are various types of antidepressants and anxiolytic drugs that are available and which are taken by the child only on the prescription by the medical practitioner. Summary. Anxiety is a complex blend of unpleasant emotions and cognitions that is both more oriented to the future and more diffuse than fear. Anxiety causes a number of physiological, cognitive as well as behavioral changes in an individual. There are 4 types of anxiety disorders in children, including generalized anxiety disorder, separation anxiety disorder, phobic anxiety disorder of childhood and social anxiety disorder of childhood. The symptoms have been mentioned after each disorder directly taken down from ICD-10. Treatment of these disorders in children is quite common, including relaxation techniques, cognitive behavior therapy and medication. That's all. Thank you.